Do you think you have lymphedema? Or perhaps you wonder if you have lipedema? Or is it both? My name is Kelly. I am a certified lymphedema therapist and physical therapist. And in this video, I'm going to help you understand the differences between lymphedema and lipedema and help someone know what symptoms to look for and the treatments for each. So keep watching. To try and make this simple and easy to follow, let's go through each at the same time. So lymphedema is a condition characterized by the buildup of lymph fluid due to blockage or damage to the lymphatic system. When the lymphatic system is compromised, such as by a surgery, lymph fluid can build up, leading to swelling. Lipedema, on the other hand, is a condition characterized by the abnormal accumulation of fat cells. So unlike lymphedema, lipedema does not involve fluid accumulation, but rather an increase in the number and size of fat cells. Lymphedema can occur anywhere in the body. It most often is seen in the arms or the legs, including the hands and the feet. But it can also occur in the pelvis, abdomen, chest, or head and neck area too. Lipedema is typically in the legs or from the hips down to the ankles, where at the ankles it creates a cuff-like appearance and it doesn't affect the feet. But sometimes it's also found in the arms, specifically more the upper arms too. Lymphedema can be considered either primary or secondary. Primary lymphedema is estimated to be 10 to 30% of all cases of lymphedema, meaning that there is a congenital or genetic component, while 70 to 90% of lymphedema is secondary, which means it was caused by a surgery, trauma, infection, or another medical issue. Lipedema is thought to have a genetic component and often becomes more apparent during puberty, pregnancy, or menopause. While the exact cause of lipedema is not fully understood, hormonal factors and genetic issues are believed to play a role. Lymphedema is typically seen as asymmetrical, which means one leg or one side, or if someone does have lymphedema on both sides, they may not be equal in size or severity, meaning one might be mild, one might be severe. Lipedema tends to be more symmetrical, so on both the left and the right side tend to look very similar. In general, the ratio of lymphedema in females to males is often reported to be around 3-to-1 or higher, which indicates that females are more frequently affected by lymphedema compared to males. The ratio of lipedema in females to males is extremely high, typically ranging from 10-to-1 or as high as 17-to-1. This means that for every one male diagnosed with lipedema, there are approximately 10 to 17 females that are affected. Diagnosing lymphedema and lipedema by a healthcare professional usually involves a combination of medical history, physical examination, and diagnostic tests. So for lymphedema, imaging tests like a lymphoscintigraphy, ICG test, or lymphedema MRIs can be helpful to visualize the lymphatic system and helps the doctors identify blockages or different changes in lymphatics. For lipedema, diagnosis is typically based on a clinical presentation, so how someone looks, and although imaging tests such as ultrasounds or MRIs may be used to rule out other conditions. Treatment for lymphedema and lipedema may look similar for some, but they often differ based on their underlying causes or symptoms. So for lymphedema management, we focus on reducing swelling, reducing fluid, improving that lymphatic flow and lymphatic drainage, and trying to prevent complications such as an infection. This may involve a combination of lymphatic drainage, wearing compression garments or compression stockings, or using compression bandages, exercises, and skincare. And in some cases, surgery may be recommended to improve lymphatic flow or to remove excess tissue like fibrosis. For lipedema, treatment aims to manage symptoms and focus on improving quality of life. So this may include lifestyle modifications like a healthy diet and regular exercise to help manage weight and reduce inflammation. Compression garments may also be used to alleviate discomfort and prevent further progression of the condition with lipedema as well. And while liposuction is sometimes considered as a treatment option for lipedema to remove that excess fat tissue, It is important to note that it is not a cure and may not be suitable for all patients. So in summary, lymphedema and lipedema are both chronic conditions that affect the body's tissues, particularly in the arms and in the legs, but they have distinct causes, symptoms, and treatments that differ from each other. Can someone have both conditions at the same time? Yes, they can. These conditions are often not diagnosed correctly, or they can also be mistaken for each other. So it can get really confusing in the healthcare world. And a proper diagnosis really is needed so that someone can get the best treatment and management to minimize symptoms, prevent complications, and improve quality of life for them. I hope you all found this video helpful, and we'll see you all in the next video. Thanks, everyone.